Are you feeling overwhelmed, anxious, or simply not yourself? This conversation is for you. Today's episode, we are getting very personal, talking about something that is very powerful and yet necessary: mental health and care. What doctors wish you know. And to help us unpack this conversation, we are joined again by the amazing Dr. Joyce Emefah Addo-Klah, a general practitioner who has worked alongside countless patients, supporting them emotionally and, of course, with their mental struggles. Dr. Joyce, welcome back.
Thank you, Betty.
Right.
It's always a privilege to talk about mental health because, it's an area that requires compassion.
Yeah.
We need to pay attention to our mental health, and it requires a lot of understanding. So it's always is a privilege to talk about mental health.
It's not often discussed, and I'm really excited that we can talk about this and unpack some of the strategies and supports
Right.
to support all of us really with our mental health.
Exactly.
Let's begin with reality. What do you see in your practice in regards to mental health?
Thank you, Betty. The reality is that mental health issues are rising, and indeed, since the pandemic, we are having more people, both young and old, who are dealing with mental health issues. So anxiety, depression, burnout. I'm hammering on the burnout because it happens to, the working class people, and particularly in my area of practice, the health workers, they deal with a lot of burnout.
You know what?
So that's, and then
say your practice, I can certainly say in the UK, in education sector,
Right.
teachers will always say that, and they always say the workload and stress.
Exactly.
So I suppose it's probably every profession, really.
Exactly. So burnout and then loneliness. So basically anxiety, depression, burnout and loneliness. And what's striking is people suffering in silence. You do not have to be silent about mental health. So many people are suffering in silence, afraid of being judged, or not taken seriously. That's why people don't talk about their mental health. And so they would rather suffer in silence than to talk about it because they're afraid of being judged. They may not be taken seriously until the ultimate they decide to commit suicide, and everyone goes like, oh, so the person was battling depression or anxiety or loneliness. So it's an area we need to pay a lot of attention to.
Wow. That silence is dangerous, isn't it? And as part of today's episode, we are going to be looking at breaking that silence.
Right.
Fantastic.
Exactly. It is, just like you said, it is dangerous, because the earlier we seek support, the easier it is to recover. But the stigma associated with mental health makes people want to wait. And they wait. Sometimes they wait until they are in crisis and may not augur well or end up well with them. So
join the episode. Make sure you are watching right to the end on how we can support to break that silence. Remember, it's about your health. So Joyce, let's get into the heart of today's conversation, which is what do doctors wish patients knew about mental health?
Right. So when it comes to our mental health, what the 5 things I'm going to share next are things I need people to be mindful of. Number 1 is knowing that your mental health is just as important as your physical health.
That's
Indeed,
right.
if you look at the WHO definition of health, which says health is a state of physical, mental, and emotional well-being, and not merely the absence of disease and infirmity. So it means your mental health is just as important as your physical health. We don't shame people for breaking their leg or breaking an arm.
Valid point.
So why do you shame someone for being anxious or struggling with their mental health? It's equally as important as your physical health. Number 2 is it's okay to ask for help. There are GPs who are trained to take care of your mental health. So it's not just, or there are specialists who are trained to take care of your mental health. So it's not just about visiting your doctor with your cold or your flu, or your it's not just about just your checkups, but it's also about asking for help. So it's definitely okay to ask for help. The third thing I would like to share is you are not alone. You are definitely not alone. 1 in 4 adults experience mental health issues every year.
Wow.
1 in 4 adults experience mental health issues every year. So it's not, if you feel everything is crashing in on you, everything is caving in, just remember that you are not alone. And the fourth thing is, you don't have to wait for a breakdown. Early intervention makes a big difference. So you don't, when it starts, when you feel like you are withdrawing, you are losing, interest in the things that you ordinarily do, you are feeling overwhelmed with your task, and you are withdrawing from friends and family, you are going through a breakup, you're going through a heartbreak, ask for help. You do not need to wait for a breakdown before you ask for help, because early intervention has been proven to save a lot of people from the ultimate, which is suicide. And then also know the fifth one is there are options. So even if you are not able to, go with the ones aforementioned, just know that there's always, always, always an option. So there's therapy,
That's right.
there's meditation, there are lifestyle changes, and then support groups. All of these things can help. You see your therapist, you go through therapy sessions, cognitive behavioral therapy. If it's, you find solace in meditation, people practice yoga and it has a lot of impact on their mental health, you can go in for that. So the 5 things we want you to be mindful of are the things I've mentioned. Mental health is equally as important as your physical health. It's okay to ask for help, and then you are not alone. And you don't have to wait for a breakdown before you seek help. And then there are always options. Yeah.
That is so powerful. So someone listening right now who is feeling off, what should they do?
Right. I always say it always starts by opening up. So talk to somebody, talk to a trusted
Break
person.
that silence.
You can talk to your doctor, you can talk to a trusted friend, you can talk to your therapist. So always start by opening up, talking to somebody. That one conversation could be the beginning of your healing journey. So please don't bottle it all in. Don't keep it all in. That doesn't make you strong.
No.
Strength is sharing. Strength is talking about it. So start by talking to a trusted person. It could be your doctor, your GP. It could be a trusted friend. It could be your therapist. So always start by talking to somebody. That is always the number 1 step in healing.
Let's touch on something that is very close to the heart of many: faith and culture. Sometimes these can complicate how people view mental health. What's your take on this?
I solely agree with you, Betty, especially in the African, Caribbean, and the faith-based communities.
Yes.
There's this belief that if you are struggling, it means it's a lack of faith. You don't have faith, or you are not strong. It shouldn't be so. They'll tell you just pray about it.
Yeah.
It's a culture that is it's difficult. Prayer is powerful. I know. I mean, we are all people of faith. Prayer is powerful, but we need to understand that God also works through people.
That's right.
God works through doctors to ensure that you are well. God works through therapists. God works through the community. So mental illness is not necessarily a spiritual weakness. It's a human condition. It's not necessarily a spiritual weakness. It's a human condition. So we need to, sway away from the fact that once you're struggling with your mental health, it means you are not strong or you don't have enough faith, right?
And I think that could be maybe one of the reasons why people will not talk about it.
Exactly.
Because they think it might be looked down upon or be seen as a spiritual weakness.
Yes. Once we know that it's a human condition, just like you would have any physical ailment, it makes everything simple. Mental illness is not spiritual weakness.
Aside therapy or medication, what lifestyle habits support good mental health?
Right. When it comes to the lifestyle, activities as subtle as movements go a long way to improve your mental health. It could be just a gentle walk, taking walks early in the morning. When you exercise, you release a lot of endorphins that boost your mood. Something as simple as movement, taking a walk, jogging, can boost your mental health. And then connection. Networking, connection is very, very, very important when we are dealing with mental health issues. You talk to people, you talk to your friends, you talk to your family. Avoid isolation, because the more you isolate yourself, it magnifies your problems and you are not able to deal with it on your own, and it feeds into a never-ending cycle. And so we need to stay connected to people. We do not need to isolate ourselves from people. And then the sleep hygiene, quality rest matters. So we have to be consistent when it comes to our sleeping. Anything that takes your sleep away, please take it out of the way.
It's not worth
Sleep is not worth your health. And then a balanced diet, because your brain needs proper fueling to be able to function well. So eat healthy, your vegetables and then your fruits. You need to cut down on ultra processed foods. You need to cut down on your sugar intake. So having a balanced, healthy meal also goes a long way to impact your mental health. And then you have to limit social media. In this age where, you have people, I always say, I'm not even able to manage 2 phones.
That's right.
And so I have to have my PA manage another one. It's just too much work. And always remember that comparison is the thief of joy. So
that's right.
What you may be seeing on social media in real life may not be. You may be in your room thinking, oh, this person has got this and has got that. That may not necessarily be their reality. So never compare your life to someone else's life if you do not know the complexities of their life. Never compare. So limit social media. Sometimes it's as good as, having a social media break. Going off WhatsApp, going off Facebook, going off Instagram, and just having that quiet moment for yourself. Because all these things, you open social media and you have news here, you have celebrity A doing all the negative information. So sometimes you need to limit social media because it impacts on your mental health. And then you practice mindfulness. That is one of my best. So breathing, deep breathing exercises, meditation, journaling. And if you're a person of faith, if you're a Muslim, you pray. If you're a Christian, you pray and then you meditate. All these things go a long way to impact our mental health.
Excellent. And it's about that small steps.
Exactly. You don't have to, overhaul your life overnight. It's just about taking simple, small steps. You can start with one thing today. Maybe it's just drinking water. Maybe it's just getting outside and going for a 10-minute walk. Maybe it's just doing something fun, something you love doing. You love crocheting or you love weaving. Finding an activity. You love gardening. Spending time in the garden, with the plants. That's nature, keeping in touch with nature. It helps a great deal. So it's about taking simple or gentle steps at a time. Start by finding something you love doing and then focus on it.
I think I love what you talked about connecting and not isolate yourself. It's so powerful.
Right.
So who are those in your circles?
Right.
Connect with them.
Right.
And I love what you're saying. Speaking out is strength.
Exactly.
So don't suffer in silence, and you are not alone. What would be a final word that you would like to share with someone who is quietly struggling?
If you're out there and you're quietly struggling, what I'd like to say to you is you are not broken. You are not alone. And that healing is very, very possible. Asking for help doesn't make you weak.
That's right.
It shows that you are choosing to live. So ask for help, speak out. You are not alone.
That's beautiful. Thank you so much for joining us.
Thank you, Betty, for having me speak about mental health.
And to our listeners, if this episode has touched you, please share it with someone who needs to hear this. And let's make it okay to say, I am not okay. Speaking out is strength. Remember, at B3 Inspire, we are building strong minds, strong hearts, and strong future. Believe in your wealth and never be afraid to ask for help. Until next time, build your foundation, believe in your potential, and become unstoppable. Be kind to yourself. Thank you for joining us.
Thank you, Betty, for having me.